Hey, what's going on? Let's talk about precision, functional health, and performance. All right. So thank you very much for tuning in for this video today. So the goal of this video, this presentation, is to give you a perspective on the nature of our terminology and our care. Our concept is called Precision Functional Health and Performance Solutions, or Precision Functional Health Performance Solutions is a little bit more accurate. And basically, I want to have you understand a couple of definitions: functional health, functional performance, what does that mean? Precision health, what does that mean? And health performance, what does that mean? Well, the definition of functional health performance is that it is a holistic approach to functional health using movement as medicine. Another way to say this would be the utilization of specific activities to directly target a physical condition. So it's a little bit broader in scope than PT, and we're trying to specifically affect chronic health conditions and the ability to perform better for life. And perform better for life is dual in meaning that we mean the length of life and the activities of life. Other terms that might be used here are exercise as medicine, MediFit, medically oriented fitness. You might have heard a lot of those things before. Hopefully, if you haven't, hopefully we'll clarify here too. Again, this is just restating, meaning the clinical relationships to proactive care through the use of prescriptive precision movement science interventions. So what does health performance mean? Well, basically, if we look at the performance spectrum, down here we have our health line, and we'll be, when you're unhealthy, you're disabled in some way. Right down here, you might be severely disabled or handicapped. Right here, you might have chronic health conditions. You might be injured. You might have chronic pain, things like that. And so above this line, you may be riding all the way up here to genetic potential, where you're really trying to swim the fastest, run the fastest, throw the farthest, something like that. And so down here, you're at a health deficit, and above this line, you have a health surplus. And so we see that health and performance cannot be separated as concepts, but are two sides of the same coin. Precision, as a term, is actually a term in healthcare. It's not just a little marketing term. It means in healthcare, the meaning is the utilization of deep diagnostics and assessments in order to make treatments or interventions specific towards the individual. And this is contrasting to the broadly treating a condition. An example of this would be genetic testing for cancer patients in order to make sure that we get less side effects and better positive effects towards those treatments. And for us, translating that to us would mean that our heavy focus on the client's comprehensive functional diagnostic and performance profile for precise strategies and identification of milestones to reach in the developmental process and strategies that we need to perform in order to get that client exactly what they want, with basically respect to an ROI, with a return on their investment of time and effort and all that kind of stuff. So what is functional medicine and functional health? Well, if we look at the term functional versus the term clinical. Well, clinical means associated with disease. Functional means associated with the function of the body or their experience, kind of referring back to that performance spectrum. Clinical is usually referring to an acute state, whereas functional is referring to a chronic or long-term state. An example would be that diabetes is probably better off with a functional long-term approach using a functional approach, and strep throat would be better off probably using a clinical or short-term approach. Reactive, clinical approaches are usually reactive after something has happened. And functional approaches are a little bit more proactive, so trying to prevent something further on from happening. Clinical, the treatments are usually going to be short term. We want to get somebody out of symptoms with medicine that might have some side effects, or surgery until the disease are gone or until the symptom is gone. And then functional, the treatments are going to be long term. Lifelong practice of nutrition, use of herbs for balancing the whole body, that sort of thing. Clinical is going to compartmentalize things, and functional is going to be holistic or interdependence with the body. Clinical is going to look at an outcome measure of in looking at a system. Maybe it's cardiovascular, maybe it's skin. Whereas functional is looking at all the systems together. They're going to look at the root cause, and how the body functions. The people that might treat you are on the clinical side are generalists, and like your primary care physician, or a specialist like a cardiovascular person or a dermatologist. And on the functional side, they're primarily going to be functional medicine specialists. They're going to be more holistic. They're going to know a lot about everything. The type of therapies on the clinical side are usually going to be pharmaceutical or surgery in terms of their base. And on the functional side, there's going to be more like nutrition and supplementation. So if we look at how health performance is used in the spectrum of healthcare, meaning, as related to those clinical and functional practitioners. Well, the spectrum of healthcare, way down here on your left-hand side, we got clinical medicine. Deals with disease and disease states. And medicine also means dealing with disease states. And then we have functional medicine. Well, functional is defined in the previous slides, but medicine also means approach, it's an approach to disease states. Integrated means that we're using both functional and clinical as approaches towards medicine. So you see, between these two lines, we're talking about medicine, which is being used as something applied towards a disease state. Whereas alternately, we have sports and strength and conditioning and all that kind of stuff. These are applied towards performance or change in function at a higher level, where these, of course, are changes in function at that lower level. If we think back towards our performance spectrum, we're doing these below that health line, and these are way above that health line. Then we have wellness or fitness, and these are kind of ambiguous terms representing this broad, this total area. It's very non-specific. We really don't know what those means. They're kind of soft terms. And so we're trying to actually apply a much better term, calling it health performance, where we use movement science implemented from what we study over here to affecting proactively specific effects over here, or proactively, which would be like kind of right here, to prevent these things. So prevention of these states, where these are reactive towards these states, both clinical, functional, and integrated, are reactive towards these states. Functional health performance is going to be proactive. And so clinical medicine, the use of the diagnostics, the diagnostics are going to be clinical, or do you have a disease or don't you? The type of therapies are going to be pharmaceutical or surgery. In functional medicine, the types of diagnostics are going to be on a functional spectrum, which is, really cool. But they're going to use nutrition and supplementation of a specific nature. And then when we get into functional health or functional health performance, we're going to look at functional spectrum diagnostics and performance assessments, along with the therapies or the interventions, we should say, of more general nutrition, more prescriptive exercise, and more active living or blue zone health interventions or strategies, I guess would be also another word. So just to sum up, functional medicine versus functional health. Functional medicine is more geared towards specific, acute, health conditions somewhat reactively. Functional health performance is geared a little bit more towards chronic or long-lasting proactive and preventative condition. Functional medicine focuses a little bit more on specific nutrition and supplementation and may include kind of general movement protocols, while functional health and performance, or functional health performance, has more of a focus on general nutrition but specific movement strategies. Other terms that we may use that you might want to become familiar with is functional training. So functional training just means the transfer of effective training outside the gym. Don't train just to be strong on the bench press. Don't train bench press just to be strong in the bench press. Train the appropriate exercise to get better outside of the gym. So, is bench press the most appropriate thing for you to be doing in the first place? Maybe, maybe not. Restorative training is a subdomain of functional training, meaning that we're trying to restore the proper minimal and then optimal, function of the body through the use of movement science. So we'd say, we want to restore the functional abilities that people need to have above that health line. That's what we're talking about, is getting people above that health line. And then, we want to restore those abilities to a minimal level. And then it's also focused on the recuperation for optimizing restoration and healing during more intense phases of physical development. So we're also going to use restorative training for people trying to train at that, genetic potential level. And so that's it. Thank you very much. I hope you got some good information and benefit from this presentation. You contact me with the information you have on this site for any questions that you may have. I look forward to hearing from you. Thank you very much.